So all this was coming together for me that it would be very important to design studies to target that particular window. And I've been doing that for many years now. First with studies in Poland, because that was a heavy coal-burning region and the air pollution levels were extraordinarily high. And then bringing that same approach back to New York City, as I was realizing that, in fact, although the exposures are far lower, there are still significant exposures, and across a gradient. In other words, some people have more exposure than others, depending on where they live. And it turns out that across the country, as well as in this city, the underserved inner city communities tend to have more exposure to air pollutants and to other contaminants because of the ability to, or the lack of ability to oppose siting of polluting sources, and the lack of information on the risks from, say, pesticides and other chemicals. I was able to get funding for some grants going along for a number of years, individual research grants, and then I proposed to my colleagues that we develop a center here, and that we put in a proposal to the federal government to fund us as one of the national centers for children's environmental health, which happened in 1998. We were one of the first 8 that were funded. And since then, we've been looking at not just one health effect of prenatal exposures and early postnatal exposures, and not just one pollutant, but looking at the real-world situation where mothers and their developing babies, young children, are exposed to multiple pollutants, air pollution from fossil fuel burning, transportation, other sources, pesticides from the use of spray pesticides in homes and apartment buildings to control pests like roaches, things like that, secondhand tobacco smoke, and endocrine disrupting chemicals that are more and more of concern, these chemicals that can mimic natural hormones like bisphenol A, for example, phthalates, chemicals that are found in plastics. And my colleagues and I have developed over the years this very broad array of research projects, all stemming from one single cohort study of pregnant women and their children that were enrolled beginning in 1998. And we've been following them and their children all the way through. Some of them are reaching their early adolescence now. And we've expanded to study not only potential cancer risk using biomarkers like chromosomal aberrations or abnormalities, but also neurodevelopmental problems, asthma and respiratory illness, very important. And then most recently we've added obesity and metabolic disorders, such as insulin resistance and diabetes. And so the center is really having a very large scope now, which takes account of the fact that in the real world there are multiple exposures, some of which can interact with each other, and that chemicals don't just do one thing. They can have multiple adverse impacts, and it's important to assess all of those and not just pigeonhole, look at one. So that's what we're doing now within the center, and I use we, the pronoun, very freely, but that refers to a large number of investigators. There are over 40 key investigators in the center, and a very devoted and hardworking group of research workers who are bilingual and have worked very effectively in keeping together this large cohort study. Well, we have used this approach, molecular epidemiology, which combines measuring biomarkers in, say, umbilical cord blood or urine or other biological samples, and pairing those measures, direct measures of exposure, chemical pollutant exposure, the damage that the exposures have done to targets like DNA or the chromosomes or the immune system, and also biomarkers that indicate susceptibility due to genetic or nutritional factors. We pair all of that information with monitoring data, personal air monitoring, stationary air monitoring, and questionnaire data. And then on the other side, with respect to the outcomes, we've looked, of course, we've combined all of this with the clinical evaluations of the babies from birth on. How well are they doing in terms of neurodevelopment? How's their respiratory health? Do they have asthma or not? Are they overweight or obese? Are there metabolic problems? And so forth. So we put all this together in our study, following these over 700 mothers and over 700 babies in New York. What have we found? We've found, and I say the we, my colleagues and I, we've published many papers on this, have found that prenatal exposure to air pollutants called the PAHs, to the pesticide chlorpyrifos, which is an organophosphate pesticide, and also secondhand smoke, do affect birth outcomes, affecting birth weight and in some cases head circumference of the babies. And later on, that these same exposures have effects on the children's cognitive neurodevelopment, mental development index, even IQ effects have been seen. And moreover, the work has shown that pollutants in the air from diesel, from general fossil fuel burning, can increase the risk of asthma and respiratory problems in childhood. That's prenatal exposures, increasing the risk of children's respiratory problems. And that can occur either alone, the air pollutants alone, or in combination with secondhand smoke. So we've published those findings, and we've also published the findings that the prenatal exposure to the air pollutants is a risk factor for increased chromosomal abnormalities, a marker that is not cancer per se, but is an indicator of potentially increased risk of cancer. So our findings are, we think our findings merit a greater protection of that period, that in utero developmental window, and also have warranted follow-up so that we're continuing to follow the children to see what are the long-term irreversible effects of these exposures. And one of the favorite studies that I'm doing within the center with my colleagues is studies in China where we were able to show recently that when a power plant, coal-fired power plant, was shut down, we saw direct benefits in terms of the children's birth outcomes and their neurodevelopmental outcomes at age 2. And we compared the group of babies who were conceived and born after the plant shut down with a similar group who were conceived and born while the plant was operating. We were able to show a significant benefit. That's the kind of study we like to do because we think that kind of positive feedback to policymakers can be very helpful. I tried to put together the two faces of the problem. Most generally, people talk about the effects of toxic chemicals from fossil fuel burning. Then they talk about the effects of climate change. And sometimes they talk about the special susceptibility of the young and children being most at risk. But never the twain generally do meet. And I thought it was important to put them together so that when we're thinking of the costs of climate change, we really think in a more holistic way. So the young child and developing fetus are not just more sensitive to the toxic chemicals that they're exposed to via their mothers breathing in or being exposed through other routes, but they are also more apt to bear the brunt of the predicted effects of global warming, including heat, strokes, flooding, malnutrition. This greater spread of infectious disease and malaria has been singled out as one of great concern. And these effects are just some of the many that are predicted from climate change, traumas, and other. And because of their lack of biological defenses and their very young age, making them more susceptible in other ways, psychological susceptibility. And so we have to consider that they will bear the greatest burden. Not that they're the only ones. I think the elderly also would be at greatest risk, but certainly the very young would bear the brunt. And if we put these all together, we have really enormous costs, potentially from our continued addiction to fossil fuel burning and the effects that is already bringing.